Hey, Future Medics, Tina here, your medic mentor, and today we're going over a medication you might see used for severe agitation or psychosis, Ziprasidone, better known by its brand name, Geodon. Now, Geodon is an atypical antipsychotic, and it's a little newer and works a little differently than the old ones we've seen like Haldol. It works on multiple neurotransmitters like dopamine and serotonin, and it helps to quiet the brain from multiple avenues, helping to calm our psychiatric patients down. The typical dose is 10 to 20 milligrams IM, and the onset is 15 to 30 minutes, with duration of 4 hours or more, depending on your patient. The nice thing about this newer age antipsychotic, as opposed to Haldol, which we just saw, is that we don't tend to have those extrapyramidal symptoms with this one, which can be safer in the long run for our patients. Side effects? Well, here's a couple. Dizziness, nausea, vomiting, a little mild restlessness, obviously sedation, but the big one that we need to watch for is prolonged QT syndrome, as this can have some effects on the heart's electrical system. So moving on with contraindications, definitely contraindicated in those with prolonged QT syndrome, as it can be very dangerous. Also, patients with electrolyte imbalances or who've had a recent heart attack. Other than that, it's known hypersensitivity. Here's your takeaway. Geodon is a second-generation antipsychotic that helps manage agitation and psychosis, especially in patients with a known mental health history. It is slower, but gentler than Haldol. Still effective, though. Has its time, has its place. Keep a very close eye on that heart monitor, and you'll be fine. But that's another medication knocked out. We're getting close to the end, and you're doing a really great job. I'll see you for the next one.